Good day, everyone. Eve, we made it. This has been such a long process, and we thank everyone for their time here today. My name is Lindsay Kay, and I'm a Canadian student in my senior year of the social work program at University of Maine at Presque Isle, and I have a strong passion for Indigenous child protection social work. After working for the past almost 10 years in the human service and child protection field, I have witnessed much substance use disorder in combination with child protection. Bringing me here to our topic of discussion today, addressing gaps in services for families struggling with substance use disorder in Maine. The issue at hand is the ongoing opioid crisis. This is not a new conversation nor a comfortable one, but now with the onset of yet another epidemic that has caused the aforementioned opioid crisis to skyrocket, we stand here today with even more families being destroyed by opioid addiction. COVID has brought on isolation, and with that, the loss of human connection that is so beneficial to so many people. This isolation and the restrictions has diminished the ability to provide what has been sometimes life-saving resources for those suffering with substance use disorder. This has put many people at risk for relapse and overdose. And as you can see here, this was a study that was done in July of 2020 in New York by Siena College. And there has been a drastic increase across the board, as you can see here, in opioid use, effects of COVID on those with substance use disorder, relapses, and the inability to provide prevention services. We all know that the opioid crisis has hit Maine hard. And so here are some statistics that drive that home. So try not to fall asleep while I go through the statistics. According to the Office of Behavioral Health, there were 504 deaths in 2020 due to overdose. That's an average of 42 deaths per month. There were 60 alone in June of this year. That's a 21% increase over the same time last year. With the increase in opioid use, unfortunately comes the consequence of children being born affected by their mother's use. According to the Maine Department of Health and Human Services in the Office of Child and Family Services, after 3 years of steady decline, as you can see here, the number of infants born addicted to drugs went up in 2020. From what had been 1 in 14, jumped to 1 in 7 in 5 of Maine's counties, as you can see here in the dark purple. With the rise in infants being born affected, there has been a rise in the number of children removed and placed into state care. This number rose by 23% from 2018 to the end of 2020. Maine has a significantly higher rate of children in care than the national average. 8.4 per thousand in Maine compared to the only 5.8 per thousand across the national average. So what's being done? Opioid use is destroying families in Maine, and substance use is one of the most common reasons for child protection services to be involved with a family. 21% of child removals are due to maternal opioid use. We have seen large sums of money being put towards resources in the state, such as the work that Options has done and the extensive efforts of harm reduction and Narcan training, as well as the Maine Maternal Opioid Misuse Initiative. These are all great starts. However, little of this money actually seems to be going towards services offered to families that are at risk to be or are already involved with child protection services. So what could be done to integrate Maine's progressive philosophy on substance use disorders into CPS practices? This has been my conversation with a plethora of people over the past year. So among the professionals that I have interviewed, there were amazing recovery coaches and different advocates from numerous agencies, different professionals working with policy and criminal justice, as well as child protection workers and Options administration. They all had much to say with a spectrum of different and very loud opinions on public policy initiatives for the opioid crisis. And they had no trouble sharing that with me. What did they have to say? Well, the biggest and the most common issue that came was the disconnect between child protection services and the recovery community. The solid and painful disconnect between the philosophies and actions of the recovery community versus the perspectives and the practices in the state human service offices, especially Department of Health and Human Services and Child Protection Services. There was much discussion of a simple lip service commitment to recovery within DHHS and no real action and certainly no collaboration with the recovery community. There's a strong division between the two, and there is little to no sustained lines of communication. Another topic that was brought to my attention several times in multiple interviews, that parents are much more likely to successfully be in recovery when they have their children with them, as opposed to a CPS apprehension. With the apprehension of children comes the loss of the parent's self-worth. And with that loss, usually comes the loss of the funds such as TANF and SNAP, that are sometimes that's the money that's paying their rent, keeping the roof over their head. So people lose their home, and therefore it is hard to follow through with the extensive case plan requirements. And it's hard for people to maintain or acquire employment to pay for a roof over their head. It's hard to maintain or gain employment with visit schedules with their children and multiple appointments and other items on their case plan. This vicious cycle will usually lead to relapses in client recovery journey without the proper communication, support, and access to the services that they need. This is why maintaining the custody of people's children is so important. It gives parents the drive to keep pushing forward for recovery. Madonna Mooney was a presenter at the Opioid Response Summit that I attended, and she emphasized that the risk of overdose greatly increases with the loss of a child through CPS apprehension. Keeping families together while recovering from substance use disorder is not easy. However, because there are very limited beds in the recovery centers for families, and there needs to be more of these. And that's something that was brought up, but in almost every interview that I conducted. Recovery coaches, again, mentioned in almost every single interview that I conducted. This was a very common topic of discussion. The knowledge that these recovery coaches have in their training is something that no textbook can give me or you. These people have firsthand experience. They have been there, done that, bought the t-shirt and wore it, and they know what to do at 3 a.m. when that big green monster comes knocking at the door. They can hold their clients' hands and they can walk them through this journey of recovery through all of the ups and downs. And the biggest takeaway from all the interviews combined, it seems, is that CPS, Child Protection Services, often fails to meet people with substance use disorder where they're at presently and work with them in a supportive and understanding manner towards recovery and achieving a healthy life with their children. Many interviewees discussed that Child Protection Services has not moved with the times. The times have advanced and they have stood stagnant. They are often reported to be very misinformed. Many of the advocates that I spoke with stated that there being a lack of knowledge and understanding of what active recovery and harm reduction processes are. Using safely and using less frequently are part of the recovery process. Not understanding those processes lead to disconnect and misunderstanding of their clients, and this can lead to difficult and frequently unnecessary case plan steps. So, how can these things be improved? These are what my recommendations are. There needs to be more mandatory education and training surrounding active recovery and harm reduction for child protection staff. With this knowledge and understanding, it would give them a better opportunity to meet the clients where they're at, and the knowledge and understanding to help them accordingly through those processes. There needs to be more positions created for recovery coaches. These people are crucial to aiding this population because, as I said, they have knowledge of how to help someone with substance use disorder, like no textbook will ever be able to tell us. Families need to stay together. That is the goal of child protection, is reuniting families and keeping families together to begin with. There needs to be more family beds at treatment facilities, as well as affordable sober living facilities. That is for the most important and crucial aftercare, because keeping families together is extremely important and strong resource to those that are in recovery. And finally, and of equal importance to all of the above, my final recommendation is for there to be embedded recovery advocates within Child Protection Services that are a neutral third party modeled after the current domestic violence advocates. Such a position would give a voice that ensures that everyone is heard on both sides of the line, and they're connected for services in the best possible way. It is awe-inspiring to have had discussions about topics that people are so passionate about. These advocates and service providers and the frontline staff that work day in and day out with this population that is so affected by this epidemic. The number of families' lives that are affected by this epidemic are in the thousands. We know this is a problem in Maine. The Mom Initiative tells us that almost 10% of babies in our state are born exposed to substances, and 80% of mothers with substance use disorder had unplanned pregnancies. 80%. These families are struggling now, and there's more coming. Talking with these frontline advocates and service providers gives us a very good view of exactly what the issues are and where the help is so desperately needed. Education, family facilities, recovery coaches, and embedded recovery advocates are just a few of the many needs of this population. However, they have a good start on a path to recovery. Recovery is a journey, and those that are struggling are trying their best, but we need to give them the tools that they need to succeed. Thank you for your time, and thank you for your attention.